Hello and welcome. My name is Jordan Watley, and I'm a practicing board-certified pediatric gastroenterologist in Charleston, South Carolina. And I'll be sharing with you today a real-life case study on the use of an amino acid formula with Synbiotics for the treatment of refractory cow's milk allergy in infancy.
Baby AB is a 3-month-old boy born full term who presented to the pediatric GI clinic with frequent spit ups and apparent discomfort and fussiness, which all seemed to begin a few weeks after birth. His standard cow's milk based infant formula was then switched to a cow's milk based extensively hydrolyzed formula, or EHF, which seemed to lead to slight improvement in his spit up frequency. However, despite the switch to an extensively hydrolyzed formula, he continued to have large volume spit ups with back arching, discomfort, and occasional feeding refusal. He was then started on famotidine by his pediatrician given his continued spit ups, but family really did not notice any improvement with that medication. During this time, he also experienced decreased stooling frequency, with bowel movements occurring every 3 to 4 days. They were accompanied by increased fussiness and straining and grunting, even more than standard infant dyschezia, that seemed to happen 1 to 2 days before bowel movements. Family denied seeing any visible blood present in the stools. And due to his stooling issues, his pediatrician actually recommended starting an infant probiotic, but the family had not started this yet due to the high out-of-pocket cost. Baby AB also has history of noisy breathing found to be due to laryngomalacia. He was seen by the pediatric ENT team just prior to being seen by pediatric GI on the same day, and he was prescribed omeprazole given concern for reflux issues impacting his laryngomalacia. The family in discussion denied hives-like reactions, but they did report mild eczema. And leading up to his pediatric GI visit, he experienced poor weight gain, gaining only 7 grams per day over the last month. So by the time he presented to the Pete's GI clinic, he was in the second percentile for weight for length with a weight for length z-score of negative 1.9. And here are baby AB's growth charts for weight, length, and weight for length. You can see here that his weight gain had slowed considerably, which raised significant concerns. His linear growth was maintained during this time, which then led to a significant decrease in his weight for length. On physical exam, he was fairly thin appearing with a decrease in subcutaneous fat stores over the upper arms and thighs. He was also fussy with exam. His anterior fontanelle was normal. He did have inspiratory stridor consistent with his history of laryngomalacia. He had normal heart sounds, a soft belly, but was slightly distended, which seemed to be consistent with gaseous distension. He had a normal external anal exam and normal muscle tone, and he was moving all of his extremities. So what is our assessment of baby AB? Well, he had a partial response to switching to an extensively hydrolyzed formula, but he continued to have frequent spit ups. He experienced poor weight gain over the last month, ongoing excessive straining with bowel movements, and continued fussiness with spit ups. So at this point, our differential diagnosis included cow's milk allergy, or CMA, refractory to the extensively hydrolyzed formula, gastroesophageal reflux disease, or GERD, possibly also related to refractory CMA, dysphagia or aspiration, and or an upper GI tract anatomic anomaly. Given the partial response to extensively hydrolyzed formula, we did suspect that baby AB was experiencing refractory cow's milk allergy, and we had significant concerns regarding his recent poor weight gain and malnutrition. Thus, we started him on a trial of an amino acid formula with Synbiotics, which we felt would address both his refractory cow's milk allergy and his stooling issues. And we provided samples to the family to be able to make this switch immediately. Because we were trialing a formula change, we recommended that he hold off on switching to the proton inhibitor prescribed by the pediatric ENT team. To further help with weight gain, we decided to concentrate his formula to 24 calories per ounce. At the time of his pediatric GI visit, he already had a planned appointment with his pediatrician scheduled for 4 days later. We discussed that if he did not have improvement with the amino acid formula with Synbiotics, we would then consider formula thickening with ground oatmeal and obtaining an upper GI series to rule out anatomic abnormalities. So what was the outcome of our plan for baby AB? Well, we contacted the family in the afternoon after his scheduled pediatrician follow-up 4 days after his pediatric GI visit. Family then reported significant improvement in spit ups. They improved from many times per day to 1 to 2 times per day. They improved from large volume to small volume. He also seemed to have no apparent discomfort with spit ups, and parents said he was happier overall. His weight gain also significantly improved. He averaged 70 grams per day over that 4 day period. And bowel movements had also improved from once every 3 to 4 days to 1 to 2 times per day. He also had improvement in straining and comfort before his bowel movements. So, really, we saw a wonderful response to the formula change. And given this excellent response, we continued him on amino acid formula with Synbiotics. We were able to prescribe this formula through WIC quickly and without issue. Today, he continues to be doing well and continues to be off of proton pump inhibitor therapy. We're also able to avoid needing to get an upper GI series or use formula thickening for him. And here's the updated weight chart for baby AB. You can see here this dramatic improvement in weight gain just 4 days after making the switch to an amino acid formula with Synbiotics. You can also see here that this improvement in weight gain has been sustained over the subsequent several months, which is quite encouraging.
So, in summary, for this baby, a switch to an amino acid formula with Synbiotics led to improved spit ups, including frequency, volume, and comfort, improved bowel movements, including increased frequency, improved straining, no discomfort with bowel movements, improved weight gain, and a happy baby, which is what families want, what we want as providers, and of course, what the baby wants most importantly. Thank you so much for joining.